Hey guys, Frank Schaller here. Welcome back. This time we are going to be talking about one of everybody's favorite patient complaints, and it is constipation. Yep, that's right, constipation. And it's kind of amazing, working in the emergency department, how many patients actually come in with this chief complaint. You'd be surprised. When somebody can't go, that's an emergency to them, right? And what we were going to talk about this week, I have a few questions for you guys. We will run through them, and I will post a follow-up video that will explain in better detail the answers to the questions I'm going to ask you guys today. So this case study, patient's initials are FOS, and patient is 80 years old. It's a female, and she's coming in today, and she comes into triage, and she just says, "Hey, I have not gone to the bathroom in an entire week." And upon further questioning, upon obtaining more history, patient states that she hasn't been having bowel movements for several years now, but this is the longest she's ever gone without having a bowel movement. So some questions for you guys regarding this case study. One would be, what do you think in terms of prevalence of constipation, more often in males or females? What are your thoughts? You get the patient's vital signs, and blood pressure is 160 over 88. Heart rate is 88. Temperature is 98.3 degrees Fahrenheit. And oxygen saturation, 98%. Respiratory rate is 20. Next question, what do you guys think? This should be an easy one for you. Constipation, more prevalent in the older patient or the younger patient? What do you think? Another question for you guys, true or false? A child comes into the clinic and they are complaining of abdominal pain. Constipation is going to end up being the most likely diagnosis, true or false? What are some red flags if you have a patient who comes in and they're complaining of constipation? Maybe there's some associated factors. Maybe there's some other findings, whether that's on physical exam or just on taking your history. What are red flags of constipation? What can you think of? When you're doing a physical exam of the patient with constipation, what does that look like exactly? What key components of the physical exam are you going to make sure that you don't forget? How about possible diagnostic studies? You're working in the ER, a patient comes in with constipation. Are they going to be getting any imaging? If so, what do you think? What imaging might they be getting? What about lab studies? What about urine testing? Anything of that nature, blood work? What are some possibilities here in a patient who arrives with constipation? And then treatment approach. How are we going to get this patient better? How are we going to get patient FOS, feeling better? What's our approach here? Starting maybe with least invasive to more invasive. What has been your experience if you've worked in the ER setting as a nurse and you've dealt with patients coming in with constipation? How did you get them better? Finally, what are some complications of constipation? Thinking maybe acutely or chronically. And don't forget, we will be posting a follow-up video in the near future with the answers to these questions. Thank you so much.